To apply a muzzle, the best position to be in is actually kind of on the side. Coming at the dog from the front can be a little bit of an intimidating pose. So if you can get on the side, that's the best position to be in. Let's try and slide the muzzle in, bring it from behind, and clip it on. Just like that. This is our restraint pole. We're going to show how this works. So you need to use the noose, and you place it over the dog's head. This and right here is where you would grab the line. This tightens it up so that the patient can't get out. You don't want to make it so tight that it's choking them, but you also don't want them to be able to back out of it. Try not to lift straight up. That will cause them to get caught and strangled, so you don't want to do that as well. Holding it like this would be the best situation. To release it, you're going to pull out this end, and it loosens the noose, and you can take it off. I'm going to show how to do a towel hold on our cat. Place her in the middle of the towel, kind of squish her into the table. I'm going to bring the towel up around her neck, around her rear legs. The same thing with this side, that way we can get to her head. You're going to pill her or maybe do a blood draw, and this keeps her from being able to claw us with her front feet and her back feet. We're going to be placing a urinary catheter on our patient here. He's been sedated for a procedure. We'll go ahead and clean our prepuce first. I've gone ahead and squirted some sterile lube out for the doctor. Get our catheter ready, and then I'll clean the penis itself. Make a little tab for her to hold on to keep the catheter sterile. I'm going to go ahead and extract his penis and clean the end. Go ahead and lubricate the catheter. Slowly advance it with that little tab that we have on it. And I can feel where I'm holding it slowly go past my fingers. I'm going to advance until we get urine back. He's a large kid, so alright, I'm going to attach our syringe and pull off a urine sample. We don't need a lot for our procedure, we'll just be sending it out. Okay, we'll remove our catheter, put his penis back in, and we are done. Yep. We're going to get a free catch sample on our dog here. Do it midstream. Let him go to the bathroom for a little bit, and then we collect our sample. Okay, we're done. They're going to get a cystocentesis sample from baby girl here. So we'll go ahead and we'll place her on her back. alcohol and clean the area. Palpate our bladder. Then we're going to go ahead and go in, making sure we're aimed a little fully. Make it one smooth motion, and then stop, and then pull it out. And the whole pressure loop here. Okay, that's it. We're going to be doing anal gland expression on this dog, so we're going to get our things together. We'll need some lube, a glove. We'll use a paper towel to catch the anal gland as it expresses, and then we've got some wipes to clean him up afterwards, and some cologne, since anal glands are stinky. Alright, so we'll go ahead and we'll put on our glove. We're going to put a little bit of lube on the end of your index finger. What? Alright. I'm going to go ahead and insert our finger a couple inches in and feel for our glands. They're usually at about like the 8 and 4 o'clock position. Okay, once you get a good feel, you can use your thumb on the outside and your index finger on the inside, and you can gently squeeze to release the gland. And we're going to do the same thing on the other side. These are pretty empty. We have a lot of material. Put some on our glove. So now that we've expressed them, we're going to clean him up. If he was very painful when we expressed them, or the material that came out looked bloody or chunky or not normal, we would go ahead and let the doctor know about that. Oh boy. We're going to be trimming some nails. We're going to get our things together. We're going to get our nail clippers and some quick stop. When you are trimming nails, what you'll be looking for is, see if you can visualize the quick, which is the blood supply. It shows the pink area right here. And the area that you're going to trim is just below that, so that he doesn't bleed from us getting into the quick area. If you have a dog with dark colored nails, you can trim a little bit at a time and see if you can visualize the quick. When you get close, it'll have a dark colored dot kind of in the center. So we'll go ahead and trim the ends of his nails. When you do this, you need to make sure that you have somebody restraining, but also make sure you get any dew claws, front dew claws or rear dew claws if the dog has those as well. Okay, that's that. Alright, we're going to do some nail trimming on this cat. When you look at them, you need to push their nails out so they pop out a little bit, and you can see the pink area and the white. We're going to trim off the hooks, which are the white area. We don't want to cut into the pink, which is the blood supply. That would hurt, cause her to bleed. Okay. Alright, that's it. We're going to be giving a medication to the dog here. Take our pill, open his mouth, put it on the far back side of his tongue. We're going to close his mouth. And he's licking, so that's a good sign. That means he's swallowed. You can go ahead and massage the throat to get them to do that. Sometimes you can blow in their nose and get them to lick, or you can always take a little bit of water and a syringe and kind of dab it in there to get them to swallow as well. And we'll let go and see if the pill comes out. And he's licked a couple times and the pill hasn't come out, so he is good. The pill went down. And that's that. We're going to go ahead and give this cat an oral medication. Okay, darling. And open his mouth. And put the pill as far back as we can. Shut his mouth. We're going to massage his neck. And you can blow on the nose and wait for them to swallow. Just did a little gulp, and then we're going to let go. Yeah, good kitty. You can also use a pill popper to get down the back of your throat as well. So there we go, and we're done. We're going to be cleaning out his ear and going ahead and applying some ear medication. So we're going to get our supplies together. Get some cotton tip applicator, some gauze. We've got our ear flash and our ear medication. So what we'll do is pull back his ear flap straight up, and we're going to fill up his ear with the ear flash until we can see it rise to the surface. We're going to close his ear, and the ear canal goes down like this. So we're going to go ahead and squish it around, try and break up any debris that's down in there. And then we can use this gauze pad to clean the surface. And we're going to allow him to shake his head. You can go, buddy. Shake. Can I shake your ear? He says, I'm not very willing to do that. So we'll go ahead and clean any debris that's risen to the surface, and you can use the cotton tip applicators for things that you can visualize, little nooks and crannies. And once you're not getting any more debris, you can go ahead and place any medication that you're giving in there. So we're going to be using this ear medication. And he's going to be getting 8 drops in his ear. So we're going to place it down into the ear canal. We'll give 8 squeezes. And then you're going to massage to try and get that ear medication down in there. It feel good? Okay, that's it. We're going to go ahead and clean this cat's ears now and apply some ear medication for an ear infection. We'll go ahead and get our gauze ready and place the cleaner in his ear, which he's probably not going to be very fond of. I know, honey. But once you see it filling up, you can place your gauze there, and the ear canal goes down. So we're going to squish it around. We'll use the cotton gauze to clean the surface, and we'll let him shake. And then whatever he's brought to the surface, we'll clean it off as well. I'm not getting any more debris. If you need to get in the nooks and crannies, you can use a little cotton tip applicator. And go ahead and put a dose of medication in here. We'll massage that down in his ear. And then we'll do the same thing to the other side. All right. Squish it around, break up the debris. Give it a shake. Good job. Let's come to the surface. Put a dose of ear medication in his ear. And massage that in. All right, and we're done. Okay. We're going to apply topical flea and heartworm prevention to this cat. We're going to make sure that it's high enough that she can't groom it off. So we're going to put it right here on the back of her skull. So go ahead and we'll separate the hair so you can see the skin. And squirt it onto her skin, the whole thing. That way she can't groom it off. Okay, stop. So after we have all of our monitoring equipment from that monitor, we go ahead and we put our esophageal stethoscope, attach it to our patient. This goes inside the patient's mouth. Because they have their endotracheal tube in place, it should go straight down into the appropriate spot. Good idea is to make sure to measure it about into the thoracic inlet so you know how far down the tube needs to go. I'm going to go ahead and slide it on into their mouth. Once in place, you are able to hear the heartbeat and the respiratory rate through this and not just rely solely on the monitor. Perform a Schirmer tear test on this dog's right eye. Go ahead and make our bend while it's in the package. Open it up. And they are labeled left and right. So make sure we grab the correct one. Alright, we'll go ahead and pull down his eyelid. Place it right inside. On the lower part of his eyelid, tuck it in, and hold that there in place for a minute. Good boy. Results. That looks good. Yeah, looks good. He is at 28. Awesome. So there's our results. Okay. We're going to take a tonometry of both of his eye pressures. We're going to put in some proparacaine on his eye, a drop in each eye to numb it up first. It's a little bit more comfortable. And while that's taking effect, we're going to go ahead and calibrate our tono pen. Get that ready. We've got a new sleeve on it. Go ahead and turn it on. It says calibrate. We'll go ahead and turn it here. And we are good. So we'll go ahead and take his measurements. Start with his right eye. We've done 3 readings, and it's giving us a 8. That eye is also an 8. We'll remove our sleeve and get it ready to be put away. We're going to do a fluorescein stain on this kitty's eye. Go ahead and get our strip out. I'm going to place it right above his cornea. Go ahead and rinse. I know, sweetie, it's cold. What a good kitty you're being. I'm sorry, love. Yeah, good job. Get our black legs. Okay. Turn off the lights. And don't see any stain uptake. All right, we can turn on the lights and go ahead and clean getting cold again, my love. I'm sorry. I know it's coming this time. Good job. We might have a little yellow discharge from his nose later. Some of the stain might come down there, right? Okay. And we're going to be preparing an enema for our little kitty friend here. I've already gotten some warm water together. I'm going to add some soap. Get our enema ready. Draw up our liquid and attach it to our enema, and then we're going to put a little lubricant on the end to help it go in. Alright, baby girl. Borrow your tissue. Stand up. Go into her bottom. She's definitely backed up. Yeah. Getting a lot of feces. Feed this in. A couple of inches. Oh, honey, here we go. Here we go, baby. Okay, and we're ready now to go ahead and administer our enema. We're going to give some sub-Q fluids to our cat here. Get some alcohol on a gauze. I'm going to go ahead and pinch the skin up and clean where we're going to insert the needle. Sure that it hasn't gone through. Okay. Go ahead and start our fluids. Drip. It's going right here underneath his skin. Alright, we've gone ahead and put on our stirrups, piece of tape on either side with a tongue depressor at the end. We'll go ahead and start with our cast padding. We'll start distal, go proximal. Keep it nice and smooth. And go all the way up past where you're going to put a splint or past where the injury is. Okay. Now we'll go ahead and put our conform our gauze on top of this. This helps keep the cast padding in place, keeps it tight. We want to make sure we're making this snug but not tight. So I'm only applying pressure after I've wrapped it around a little bit. Go up all the way to the very end. Wrap it around back here. We'll go ahead and apply our stirrups now. Okay. Attach our stirrups, the bandage in place, and then our outer layer will be done with that wrap. We'll make sure we still leave our toes poking out so we can check the circulation on them. If we needed to, we could do additional layers of the cast padding or the gauze. If we needed this to be a more bulkier bandage. Or go around a couple places where the splint might be applying some pressure. Alright, and that's it. We're going to take this modified Robert Jones bandage off of this patient. He's had it on for several days. We're going to put him on his side. That's a good pop. That's a good pop. There we go. For our outer layer, we had used Elasticon for this patient. And then it has a layer of Conform, and then cast padding underneath that with our stirrups at the very bottom.
It's okay. It's okay, buddy.
So it's attached to my toes. It's not okay. Fuzzy feet, dude.
It's okay.
Good boy. There we go. There we go.
Good boy, Biscuit.
This shows all of our layers. We've got our stirrups, cast padding, Conform, and then our outer layer. Go ahead and peel all this back. We're going to gently peel the stirrups off. That's it. We're going to place modified Robert Jones bandage on this dog's front leg and then attach a splint. Go ahead and start with our stirrups. Compressor, so we can hold the stirrups out before we attach it to our outer layer. Now we're going to go ahead and do our layer of Conform. Start distally and go proximal. Making sure that it's nice and flat and smooth. We want to have some tension, but we don't want it tight. In case there's any swelling, that'll occlude any vessels on the dog's legs and the circulation will be bad. We want to go all the way past where we're going to put the splint, so it's got a little cushion. So we're going past his elbow. Go ahead and cut this layer off. Our next layer is our padding, which is our cast padding. Same technique, making sure we're making it smooth and covering half of the previous layer. And going all the way up past where our splint's going to be. At this point, we can go ahead and put our stirrups on, take them off. Easy does it, Bubba. We're going to turn them around and reflect them back on the bandage. This keeps our bandage in place. And now it's time for us to put our splint. So we'll go ahead and make sure that our splint is positioned correctly, that it's long enough or short enough, as the case may be. And then we're going to attach it with the outer layer, which is going to be vet wrap in this case. It's very easy to put too much tension with the vet wrap, so you need to make sure that you're not making it too tight. We want this layer to be nice and smooth so that it will stay attached as well. Go all the way up here. And now we'll go ahead and show how we would remove a bandage like this. So in this case, since it was just put on, I'm able to find the edge of where the vet wrap ended. If it was long enough ago, though, that you couldn't, you could just use your scissors and place them underneath the vet wrap to cut that layer off, to take off the splint. Take off our splints. We can peel back our stirrups. Remove it. Just like with the outer layer, we do have the option of sticking some scissors up underneath there and cutting it a little bit at a time until we've worked our way able to peel it back. This is our final layer. Take his stripes off, just like that, and we're done. Put an emergency bandage on her. Her incision is oozing, so we want to try and get the oozing to stop. So we'll go ahead and place some clean gauze on there. We're going to take our vet wrap, we're going to wrap it around, making sure that it's not too tight. We want pressure, but we don't want it to be really tight. I know. What did we do to you? Once the gauze is in place, go ahead. Cut that loose. And we'll make a note on her chart of when we place this so we can check on it. Okay. We're going to go ahead and triage our patient who's come in for an emergency. We go ahead and start with our airway. We want to make sure that she's breathing okay. You can feel on her lungs. We're going to take a listen to her breath sounds. Listen to both of our sides. Make sure that the rate is good, that the amount of respirations in a minute are good. We're going to check her circulation. We're going to look at her color, see what her cap refill time is. Take a look in her mouth. Go ahead and take a listen to her heart. Make sure that the rate is good. The quality of the beats are sufficient. And then we're going to go ahead and feel for her femoral pulses. Make sure that those are stable as well. Look for that on both sides. While we're doing all this, we can assess for any external injuries that are going on. If she's got any sort of lacerations or wounds or anything, so we can go ahead and assess that. take a feel of her extremities, make sure that they are nice and warm, nothing's cold, not getting provision circulation in there, and then assess her mental state. Is she bright, alert? Is she tunded? Is she dull? So right now she's just quiet, but she's alert and responsive. So I would not put her higher up on the triage if needing to be seen. She's pretty stable, so we can go ahead and have her wait for the doctor to be seen. Perform laceration cleaning on this dog. We're going to start by placing our lube in the wound so that our hair doesn't get inside of it. Now we're going to go ahead and clip around the wound. We have that lube there that keeps the hair from getting in the way. Once the hair has been clipped, we can irrigate the wound. Go ahead and take our scrub here, and we're going to wipe away our lube. Go ahead and irrigate our injury. Some Chlorhex flush. Clean anything that we need to around it. If we were going to treat the wound, we would go ahead and apply our ointment as the last step. Right. And that takes care of it. We have a patient here who's come in for a dental cleaning. We've gone ahead and anesthetized him. We're going to go ahead and do our initial assessment. We have our mask on, we have our gloves, and we have our eye protection to keep us from getting any airborne bacteria. We've got a little bit of gum redness, tartar mainly on these carnassials up here, and a little bit on the incisor. Gonna take a quick feel, make sure I don't feel any loose teeth or anything like that. Overall, it just appears that he's got some tartar for us to go ahead and take care of and a little bit of gum disease. So we'll go ahead and we'll get started. I'm going to demonstrate how we use our manual Profi. We're going to take our scaler and at a downward angle away from the gum line, scrape off the tartar. We want to make sure that we're going away from the gum line to minimize as much trauma as possible. If you have large chunks, you can use some tartar forceps to go ahead and break off those as you go along. Another option would be an ultrasonic scaler. You want to make sure that you're keeping your tip on its side and don't remain on the same area more than just a few seconds since it is hot. We don't want to do any damage to the enamel of the tooth. Make sure we move it around. Alright, so we've scaled the tartar off of all of our teeth. When we've done that, we've created etching in the enamel. No matter how careful you are with your strokes when you're doing a manual Profi or an ultrasonic, you're going to make some etching into the enamel. So we're going to go ahead and polish the teeth, try and make it as smooth a surface as possible so that the tartar doesn't have somewhere as easily to adhere to it. We'll go ahead and get our paste. Put it in our Profi cup. We polish our teeth. We don't want to spend a lot of time doing it. We don't want to do more damage to the enamel than possible. So we're going to just spend about 5 seconds. We're going to push down just a tiny bit. And go ahead and do that. We want to make sure we're doing every surface that we've touched with the scalers. Alright, we've gone ahead and polished all of our teeth, so now we need to go ahead and rinse the polish paste off. We have two options. You can use Chlorhex rinse. Go ahead and rinse that off, or you can use water. And now that we have our mouth rinsed, we can go ahead and proceed with our fluoride treatment. We go ahead and put a small amount to contact the enamel of the tooth, and we leave it on there for about 2 to 3 minutes. It needs to make contact with the enamel. Put it on all of our teeth. Okay, so after dental, there needs to be discussion had regarding at-home dental care. The best option for your pet would be to brush daily, especially after a meal. Important thing is using a toothbrush that's soft, so it's gentle, soft bristles and gentle on your pet's gums, and using a pet-friendly toothpaste, something that does not have fluoride in it, since they can't rinse and spit like we can. There are a lot of different routes to go to getting your pet used to having their teeth brushed, starting with a small sample on your finger, letting them lick it, then rubbing it on their gums, and then doing it a little bit at a time and having them get used to it. Very much positive reinforcement needs to be done here so that they are accepting of it. The main thing is it needs to be mechanical scrubbing. It's not so much the length of time or the exact area where you get it. Mechanical scrubbing is just the bestest thing. So you don't have to sit there and do a whole bunch of brushing like we do with our teeth, getting in absolutely every nook and cranny. The main thing is we are trying to keep that plaque from calcifying into tartar. So the mechanical scrubbing action is the best option. Another option would be a rinse, a chlorhexidine rinse that you squirt in there after each meal. You can squirt it in one side and up the other, and then when they go like this, they swirl it about and get it around their mouth, and the Chlorhex will help with the bacterial fighting portion of it, and then it kind of makes the teeth kind of slick so that the plaque and tartar can't be formed as easily. Another good option a lot of people want to go with is a chew. The main important things with chews is making sure you've got something that's safe for your pet that will also do the job. This product, CET Hextra Chew, has been treated with chlorhexidine, an antibacterial agent, so they'll get that bacterial agent to fight the bad breath, but also when they chew on it, they get the mechanical scrubbing action. It's different than most chews in that it has been pre-treated, so it's not going to swell in their tummy like a lot of those pressed rawhide bones and such. The main thing is making sure that you are with your pet while they're eating this so that they don't just try and swallow it whole. I mean, obviously it would not swell in their tummy, but that doesn't mean it's not going to be uncomfortable or get stuck. So, using these on a day-to-day basis are really advantageous too. This product, there are lots of different food manufacturers that make some formulation of it, but this is a dental health diet, something that's safe to give your pet as their meal each day. The purpose behind it is that it's a larger base kibble, forcing the pet to have to bite into it in order to get that mechanical scrubbing action. A lot of the kibble is small, and a lot of pets can just swallow it whole, and they won't get that mechanical scrubbing action. So a lot of the diets like this, they come in two different sizes, one that's larger for big dogs, and one that's slightly smaller like this one that's more suited for medium and small dogs. But the main focus behind it is having them bite and chew. biting and chewing causes mechanical scrubbing action, which will deter the plaque and tartar from just sitting there on their teeth and calcifying into that tartar. So